and the new provider at Northwest School Health Center, family nurse practitioner Kassidy Treacey. Welcome to the show.
Hello, thank you.
Hello. Good morning.
Yeah, good to see you.
You too.
So things are good at Northwest.
Yes, yeah.
And Christina, this is exciting because Northwest went without a provider for a while.
Long time.
Yeah.
Long time, and Kassidy, I think, really is the perfect fit.
Yeah.
This is our first week seeing patients, but already full. So
Yeah.
students are coming down, which is what we are striving for.
That's
So,
awesome.
Yeah.
What are some of the services that students can come visit you for?
Medical care, sick visits, annual visits. We really encourage everyone to come down for their sports physicals,
Yeah.
Getting those well childs in. So that we're not behind on those sports
How
physical
nice
forms.
is that for parents? You just
Yeah,
get the, hey, you
absolutely.
can get the physical done at school. That's so nice.
Yes.
And really, there's not a provider that's close by. You're out there all by yourself, so it's been kind of a desert.
Yeah, absolutely. It's so nice. It's a great location for people that can't come down into downtown Center for Family Health. So it's utilized by a lot of people. I
Yeah.
think the location's a big convenience for everyone.
Kassidy, tell us a little bit about yourself and how you, where you're from and how you got to the center.
Yeah, I'm kind of from the Brooklyn area. I was a student at Michigan State, and I was lucky enough to do a lot of my clinical time at the Center for Family Health. So that's how I got to know them, and I really enjoyed it, and I was lucky enough to get a job there. So
Were you surprised, even though you're kind of from this area, about the Center for Family Health and the size of the scope of services
Yeah.
that they provide?
Absolutely. I think being able to do clinical at a few different sites, this one really stuck out to me because of all the services that we offer, some conveniences there, just being able to provide a lot of care as far as social services and medical care and things like that have been great. So.
And being based at a school, things like school sports physicals,
Yeah.
immunizations, you can do all that right there.
Yes, correct. Yes, we do that. We do blood draws, so any lab work that you need to get done, we can do that right there as well.
And even though sports has started, you're still doing sports physicals. It's,
Yes.
yeah.
It's always this time of year, late August, early September. Kids are welcome to walk down. Again, they don't need an appointment, so that's just one thing I really want parents to know is that if you don't feel well, come down and see us, and we'll get them back to class.
We talk about it all the time in the fall, but not every athlete is in a fall sport. Sometimes
Correct.
it's winter, sometimes it's spring, and that's their only sport. So year-round option for sure.
And I think the first week of school can be stressful, but I know a lot of kids are also stressed over the tragedy we had last week in Minneapolis. But mental health services is something you also provide at the school health centers.
Yes, absolutely.
Yep, we have our therapist Lindsay at our Northwest location. She sees students as well as, well, we try to just prioritize our students, of course, main thing. But we do offer all those mental health services to students, which is also convenient to come down from class and not, and, there's barriers sometimes to get to and from appointments, and mental health services is one of those. So glad that we can provide that for students.
What's your initial thought about Northwest so far?
I've loved it. Like we said, this is my first week there, so this will be my third day today. I love it. I was actually able to be there as a student, so I was able to kind of be introduced a little bit, and I just love the area. I love the
cool.
office, and I love all the patients we get to see.
Do you know the slogan?
The slogan of Northwest.
Yeah. We
No,
are?
No, I don't know that.
Oh, no.
Oh, we are Mounties.
I can do it.
Yeah.
Okay.
Go ahead, do
Okay.
it.
I'll do it.
All right. We are.
Northwest,
Go.
Mounties.
Okay. Okay. Good.
You'll have that down by the end of the week for sure.
Yeah, I think it's required.
It
Everyone.
is.
Okay.
It is required.
So you're at Northwest at Kidder School, but it's not just students and school personnel. The whole community can go.
Exactly. Yeah.
Yeah, the doors are open for adults, children, ages from infant to however old, and Kassidy is able to see all of them and provide the services that we offer at the main office, just at the convenient location of being out at Northwest.
So now school has started. How soon are we going to start to see things like strep and flu and
Hand, foot, and mouth. I like that one. That's a
hand, foot, and
that is
mouth?
a classic.
Pink eye.
Yep.
Yeah.
RSV is going around
Really?
surprisingly this soon, which is crazy. Yes, that's going around, but we are seeing, I think Kassidy's seen a few sore throats already
Really?
with
Yes.
school starting this early.
How have the kids been so far?
They've been great. I love seeing the kids, seeing them walk down and be able to use our services that are so convenient has been wonderful so far. So
And you came from a fast-paced work environment, the ER.
Yes.
So how are things a little more relaxed?
A little more relaxed. I think as a new provider, getting used to my position is definitely a learning thing in itself. But having my background in the ER has been great, so I kind of know where we're trying to keep patients out of. So
We're talking about keeping the community healthier, and this certainly helps do that.
Yes.
Talk a little bit about, ballpark, the amount of patients that Kassidy is going to be able to see throughout the year, and it's amazing.
It is. So her schedule is 7:30 a.m. to 4 p.m. and we're open 7 days, through the summer break and all breaks. So through the school, we don't close. And she's able to accommodate, right now a little bit limited because she's just started out there, but eventually 20 plus patients a day.
Do you have the school lunch? Do you do recess?
no, I don't get that. I get a lunch, but not school lunch. I don't believe.
We can help you with that school lunch. We know some people. It's a fine school lunch.
It is. I love their lunch. I think
It's
that's
fancy catering is what it is.
It'd be the highlight for me.
The lunch?
For school.
Yeah.
It was when I was in school.
Yeah.
We should work that into the partnership.
Yes.
I think
that's a
You
good
know what I
idea.
mean?
Should be part of the deal. And you can recommend the hot lunch to the kids when they're in there to see you.
Exactly.
You've got really one-stop service. You can then prescribe medications, and you have your own pharmacy.
Yes, down at the main building.
The main office, which is up and going again. The drive-throughs picked up a lot of momentum, so we're really happy about that, making it even more convenient for patients that they don't need to come in. They can just go through the pharmacy drive-through now.
So Kassidy, do you get to make the decision on whether or not a child gets to go home from school or not? That's a big deal.
I believe I'm there to kind of have a say and provide guidance, so we'll see how that goes.
It'll be funny if if you have any tricksters try and come in and fool you a little bit.
I'm sure that's expected, kids in school, so I'm sure I've done that a time or two.
Yeah,
so.
absolutely.
Andy knows all the tricks.
Yeah, okay.
Yep. I have a headache.
Yeah.
Well, in its 34th year, thanks to everyone at the Center for Family Health for all the great service you provide our community, and thanks for coming in today.
Yeah, thank you
Thank
for
you so
having
much.
us.
Thank you both.
It's always good coming here.
Christina Henderson is the School Health Center Manager, and you can find her at all of the school health centers.
Yes.
And Kassidy Treacey, the new provider at Northwest, a family nurse practitioner. Thanks so much.
Yeah, thank
Thank
you.
you.
Thank you, guys.
so much.
Thanks.
More of the morning show after this.